Let me turn this off. Okay. What's good? How's your
Uh,
Easter going?
so far so good.
Okay, that's what's up.
Not much since you know the deal in New York City.
I
We
know.
we don't have the luxury of walking around like some other states.
Exactly, exactly. But everybody's on lockdown right now.
Most
So-
likely, because I mean, what they usually like to say, you reach the plateau, and people don't really get that notion is when you're flattening the curve, it's just that you don't get more than what you were expecting to get. But that
Mhm.
doesn't mean that the numbers are not gonna be high, because that means you had a pick. You're right here. You flatten the curve, but how long you gonna keep up with this curve until you start going downwards? So if you're not
Mhm.
going downwards for the next 4 months, that means you're still gonna have a certain amount of death, 800. It stays consistent, 800 a day, until you starting getting less cases coming to the hospital and less people dying from the disease and also.
All right. We getting into it. We gonna get into it, but let me just do the introduction. Okay,
Okay.
so what's up guys? Happy Sunday, happy Easter,
Happy Easter.
happy 15th, I don't know, 20th day of quarantine. I don't know what it is right now. Happy third week of lockdown in New York City, you know. But it's your girl Zoe Rose Gold. But I'm putting on my nursing hat today. I'm Nurse Rose today because we got stuff to talk about. And I brought my friend Dr. Michelle Bertrand Jr. We really got stuff to talk about because there's stuff going on in our community that we have to address. Okay, so right now, okay, so I'm coming. This is from the Washington Post. I got my information from. So it says that African American blacks have 3 to 4 times the infection rate of the coronavirus. The the death rate is 6 times more than Caucasian people, white people. Okay. So, and Louisiana, which is getting it the worst, right? 70% of the deaths, 70% of the deaths of from coronavirus are happening with African American people. And in Louisiana, African Americans are only 32% of the population. Okay, so obviously there's a huge disparity with race and fatalities with the coronavirus. So we wanted to bring it up. We wanted to talk about it because that's really the issue of the day, of the actual week. Okay, so um, so I know underlying conditions affect really is a major factor in fatalities with the coronavirus. So we're gonna talk about that a little bit. Heart disease, diabetes, lung disease, things like that. So so how do you think that the underlying diseases, why are these underlying diseases affecting people and causing them to die so much?
Everybody watching, it's Dr. Michelle. I mean, the first thing we skip every time we stay talking about underlying disease, people don't stress enough about being overweight and being obese.
Mm-hmm.
Because most of the type 2 diabetes, hypertension, hyperlipidemia, they come from that pool of patient, most likely.
Mm-hmm.
And this is why I'm addressing this. For example, if you go to it's called the behavioral behavioral risk factor surveillance system. That's where you're gonna report, for example, conditions that are tied to a type of behavior. And one of
Right.
the biggest concern, for example, is in America. 25% of the people living in America in 48 states, 25% of them are obese. That's one thing.
Mm-hmm.
And then they have it break down in some states like I think I was looking at some numbers, some state like Mississippi, West Virginia, they have like 39.5% of the population living there obese.
Yeah.
And what obesity does, is it predisposes you now to have those chronic disease such as hypertension, diabetes,
Right.
and those also are underlying causes of heart disease, kidney disease. And now we're not even talking about alcohol that could lead you to liver disease, cirrhosis, and everything. So it's a whole package, but the world problems come straight out of the obesity rate that we have in this country. And it's even more concerning and you look at it in the black community. Because
Right.
when they give you the numbers for the black community,
Right.
breakdown in men and women, you're gonna see that women now are more likely to be more obese than the men,
Mm-hmm.
and with a
Mm-hmm.
huge difference in the percentage. But
Mm.
generally speaking, meaning if you put them together, we can say that there are 88% of the black African American living in this country who are obese.
You was
48%.
88%, you would say?
No, 48%.
Oh,
Okay. Yeah,
48%. Okay.
48% of the black American African American living in this country are obese. And
Mm-hmm. Mm-hmm.
now in our group also there are a lot of severe cases of what they call childhood obesity. So now if the child is already obese at a very young age, it
Right.
put them at risk of developing, those chronic disease even at an early age. And you're talking about like close to 27, 30 years old, and you're already diabetic, you're already hypertensive as a
Mm-hmm.
result of that. So these are this is where you should pr- primarily address the problem. It's a behavioral.
Mm-hmm.
It's a problem of a lifestyle, you know,
Right.
and adding to the health disparities in the way that you don't even have access to health care the same way some other ethnicities have access to it. Okay,
Right.
if you look at the numbers, only 12.1 or 12.2%, if I can round it, of the people under age 65, okay, they have access to health coverage.
Okay.
Okay, so these are alarming numbers. Okay,
Mm.
all so all these people that are left without from age six, I mean 65 and under, who are left with no health insurance. It
Mm.
tells you now in a moment of crisis, for example, like this, where when you get sick, your first reflex is to go to the doctor
Right.
and get some answers. If you don't have any health insurance, you are more likely to wait when you really don't feel better or
Right.
you're really ill sick to go to
Right.
the emergency room because
Yeah.
you don't have the privilege to get a first encounter with your primary care, you
Right.
know, because it's going to be out of pocket. So now,
Yes.
let's say we have a situation of crisis. What was the first thing people did when they had money? When they announced that we're going to lock the country? First thing people went and do and buy a bunch of stuff, so they can shield in. But most of these people who buy a lot of stuff spend all that money. A lot of them may end up with no job after that because they
Mm-hmm.
lost their job, or still have to go work because they were among the essential workers with no protective gears in the community. I mean, no
Okay.
protective manners in the
Yeah,
community.
we're gonna go into that,
What?
but yeah, definitely the disease part. So you're basically to summarize it, you're connecting obesity to these underlying diseases that they
Yes,
manifest these underlying diseases like hypertension. If you're bigger, it's gonna take more for your heart to get everything, all the blood around your body. If
no, man,
if you're 100 pounds, to 300 pounds, it's gonna be more on your heart to circulate the blood in your body. So you're gonna have hypertension.
but I can give you the numbers. You hear
Hmm.
this, they say about diabetes, for example.
Right.
I just said that 48% of the black African American living in this country are obese. But 80% of that 48%, when you put a total number on that,
Right.
80% of them are more likely to become diabetic.
Right.
80% of them is more
Right.
likely to become diabetic. Okay?
Hmm.
So all of that combination of is unhealthy food, when they say unhealthy lifestyle, lack of exercises, unhealthy food, and all of the package, that they give you. but it's not the reality in the community because it's not about telling people you have to change your lifestyle, you have to exercise more, you have to do this, you have to do that, when the environment does not allow that. That's where all of those health disparities, but the numbers are there, you know,
Right.
and they tell you these people who have diabetes, for example, meaning that because 80% of the black African American out of 48% that are obese are more likely to become diabetic. They
Mm-hmm.
tell you also they are 2.4 times more likely to have end stage renal disease
Right.
because
Right.
once you get in
Diabetes.
diabetic, that you become
Mm-hmm.
diabetic, you become hypertensive. There
Right.
are some complication, long-term complication related to it, like such as heart failure, kidney failure, you know. And
Right.
now, if you add cigarettes in it, people
Right.
may be end up getting COPD, and then you have chronic respiratory failure. There's a lot of different things that comes when we talk about health disparities. We cannot see it on one on a technical standpoint where we say, oh, maybe they didn't have enough ventilators in the hospital or in these hospitals that were taking care of this community. But
Mm.
this is a technical issue. What COVID is going to capitalize really is your underlying conditions, those comorbidities. And remember,
Right.
since the first live, we start stressing on it to tell them that forget about everything you're listening on the internet about we are more likely to be resistant to the COVID, and we know we addressed that one time, but we told you no, this has nothing to do with your genes or your race, is those underlying conditions. And if you
Right.
are predisposed or you already have them on there with related complication,
Right.
once you get COVID, it's gonna be more difficult for you to get out of the situation because those organs are already stressed
Yeah.
by your chronic situation, and now
Right.
you're putting an insult on them with this disease.
Right. So in layman terms, everybody, it's hard for your body to fight like two major things at one time. It's like, like say if you're fighting somebody, right? Say you call that person diabetes or you call that person hypertension. Okay, you're fighting that person, but it's like you add the coronavirus, now you're getting jumped, okay, at that point. So now you got these everything jumping you at one time, and then when in the streets when you getting jumped, you could give a couple of jabs here and there, but you probably gonna get beat up, and it's you might die, so basically that's how it is. It's like you're getting jumped by all these different diseases. So it's good, the best thing, honestly, to prevent getting really sick from the coronavirus is to keep your health to be in the best shape as you can. Okay, so we didn't even mention lung disease, but obesity does cause lung disease as well, because a lot of people who are overweight, you you
Hy-
know you
they
you
are
you hear them.
hyperventilating.
Right, you hear them snoring and things like that, and you're like, "Oh, this guy just snores a lot." But obesity affects that. Obesity causes sleep apnea, and you snoring, things like that. And so again, lung disease. If you have a lung disease like asthma or any COPD, other lung diseases, that is something that is like a catalyst for the COVID virus to just go crazy and really affect your lungs. So you want to touch on that a little bit more on lung disease,
I mean,
or
well, it's still controversial because all these here things you've been listening to. It's like cigarettes is less safe than this. You better do vaping than, or I better smoke marijuana. There's different things, but
mm-hmm,
right now, when you address the issue and tell people that's not a good time to drink, that's not a good time to smoke, we've been telling this because now you are everything that you get in your body, okay, the liver, the kidney interact, you know, to work together and get the whatever that's toxic for you, it's gonna get it out of the body. But
right,
now, if you're in a situation where you need the liver to concentrate on this condition right here that you have, and it's
mm-hmm,
on the siege. It's a virus. It's attacking everything. It's not
yeah,
only giving you a respiratory failure and it's systemic. It's spread all over the place. So whatever
Yeah.
it's gonna go and your body's not capable of fighting it, it's gonna give you kidney failure. It's gonna give you liver failure, and more likely it's a respiratory disease. So the main factor is respiratory failure. But people
Mhm.
with COPD, they already have a chronic lung disease where a lot of that a lot of that lung tissue is has fibrosis.
Right.
Okay, so therefore it's like you breathing at 70%, 60% of your own capacity of the lung capacity because the
Mhm.
other tissue is already dead. It's not working well, you know, as a result of long years of smoking.
Right.
That's why they call it a chronic lung disease. It's not like asthma where you maybe have a predisposition to be asthmatic. It could be you were born like that. It's genetic, but smoking can also cause you to have COPD. And now some people are actually dependent of oxygen.
Right.
Okay, they're
Right.
dependent of oxygen. So
Right.
if your lung is already functioning at 60, 70%, and now you have a disease that is affecting it, so
Right.
the outcome is almost, 1 or 2%, unless that there's a miracle drug or a
Right.
vaccine that comes straight, or you maybe have someone to give you plasma, or you may be affected by a strain also that is as not as that that's not as virulent that some of because there's 8 strains out there. So
Right.
some people have a mild form or as well. So if you're lucky to be among these people that have a mild that end up contracting the mild form of the disease, so you may recover, but the age comes comes in place. So
Okay.
I mean, comes into effect. So it's not even something that you can explain in a few words because it gives you a multiple package of complication
Right.
that you have to address with different specialties because they emphasize on ventilator because that's the main cause of death. People are actually, in respiratory failure, hypoxic, and then they almost like choking, you know,
Uh-huh.
because they can get the air in, and that's why you want to help them with the ventilator. But
Right.
when the other organs are not working well, it creates another situation. And I'm even going to mention, for example, hypertension.
Right.
Before we even talk about COPD, very often you work in the system. You did DRG with me, and then we also you often see those diabetic complications,
Mhm.
neuropathy, nephropathy,
All that.
and
Mhm.
hypertensive heart disease,
Mhm.
hypertensive chronic kidney disease. Those conditions tells you that if you have them and you don't manage them, they're more likely to give you those complications. In the
Right.
Black African community, the percentage says 30% of the men are more likely to become hypertensive. 60% of the women are more likely to become hypertensive.
Mhm.
And
Okay.
in bold letter, they are less likely to get it under control. And
Mm.
this is one of another key factor when talking about health disparities. And
Right.
I more
Right.
likely know that you can get it under control is because either you don't have insurance,
Right.
so if you don't have health insurance, more likely, or your background may makes it not. It's not a priority to me, or because a lot of Black African Americans comes from foreign countries. You still have those, homemade medicines that they're gonna make you try until you actually getting sick and you go to the doctors. Or if it was unknown, if you don't go to the doctor, you may not even know that you're hypertensive until you get a stroke.
Right. Yeah.
And
So,
these are different
mhm.
factors and once you get a stroke, most likely you may walk out with like disabilities.
Right.
And now
Okay.
you're not even active in the work
Right.
environment now, so therefore it's a lot of different things
There's a
that.
lot of things, and the thing is, I want to emphasize that we're not saying that African Americans are genetically predisposed to these diseases. We're not predisposed, but there's a lot of social and economic issues that and basically systemic racism that has caused these diseases to be prominent in our community. You know, One thing I want to talk about, because I mean, with coronavirus, the whole world is talking about social distancing. Okay, but in a lot of Black communities, which are usually more poor, um, is poor and congested. Like I went to see one of my patients in Brooklyn, and I had to be on a elevator, a small elevator, like 4x4 elevator, and there's people on it. You know what I'm saying? So it's hard to be there's hard social distancing there. And then you live in the buildings, and people are close together as well. So these communities also, it's harder to have social distancing. So you want to talk about why you think social distancing is really, really important?
I mean, it's it's not that you have a clear understanding of what's going on because before they used to say it's not airborne as long you wash your hands and you respect a certain distance. Because if it went from washing your hands to we need to add social distancing as a
Right.
measure to
Mm-hmm.
control it and to realize that social distancing and washing your hands is not enough because at the rate people are getting infected and you get stories from people also who got infected. Some people don't even know how they got
Right.
infected
Mm-hmm.
because they
Yeah.
tell you I took all type of precaution. I was wearing gloves. I was washing my hands every
Right.
5 minutes, you know. And some people even told you that I was wearing a mask when I was around people that was coughing, sneezing,
Right.
you
Right.
know. And how did I get it? Until they realized that there was a study in a simulation that shows that some tiny droplets when people are talking are also staying in the air. So you might be inhaling it while you're talking to someone else because you're
Right.
not, these are like microscopic droplets. You're not even gonna see that with your eyes. And these
Right.
stay floating in the air for a certain amount of time.
For a certain amount
So
of time.
let's
Mm-hmm.
say for 20 minutes of interaction with someone while you're speaking, and there's a lot of these droplets. If you're not wearing a mask, you may inhale it even though you saying we staying 6 feet from each other.
Right. Right.
It's not something that they confirm, but they have a simulation. So
Right.
therefore, when you have all of these different factors, it's easy to say that okay, everybody wear a face clothing and wear a mask when you are in the community, because
Right.
what makes it confusing compared to other countries, other countries actually make a shutdown or lockdown,
Mm-hmm.
there's no such thing as, okay, we're gonna keep the essential workers, which are maybe doctors, police officers, but in our country, there's a lot of different other workers. Like there was the meat packing industry, people delivering mails, a lot of different things were still working in addition to doctors, police officers, firefighters that were out there. So it was more likely a partial lockdown for people who can work from home, people
Mm-hmm.
who gonna be laid off because they don't have a job, restaurants are closing, but there was a big chunk of people still working. And who are these people? Black African Americans, Hispanic people. It's not even
Mm-hmm.
just Black African minorities people,
Minorities. Yeah.
because
Colored.
we were actually the ones still keeping these things running. So
Right.
when you put this and we were already in the situation. Can you find hand sanitizers anywhere? No. Can you find a glove,
Right.
a mask anywhere? No.
You
So
can't. Mm-hmm.
no outreach was done to at least make sure the environment is safe for everybody that has to go out there for a while until you stay. Okay, everybody stay home because that's the notion we don't have here. Is if you feel that it's a disease that is a communicable disease, make sure these people that must be out there, they have the right
They're
protective gear
protected.
because
Right.
every time they go out there they have a chance to getting it and bringing it to their family.
Right.
And
And
this one
mm-hmm.
is a silent killer in a way that I may have it, you may have it, we won't
Right.
know because we have no symptoms.
Right. Mm-hmm.
How do
Mm-hmm.
you know that you have you contracted a virus if you don't even have a runny nose?
Right.
And you feeling okay, you're gonna be going out there, continue to do your job, continue to infect people
Right.
while doing the course. I mean, doing the course of your duty, and then later on, because that interaction, I'm passing it, I'm getting it, I'm passing it, I'm getting it. So now your viral load is so high by the time you start getting symptoms that
Right.
you're more likely gonna end up in the hospital. Because
Exactly.
at
You've
some
been
point
exposed
your
so
body
much.
can even fight that much because you
Right.
keep infecting yourself through the same way. Because take example of one place that has one case and it says all of a sudden 60 people, 30 people in the same spot got infected. So
Right.
it tells you a lot that this is not a virus that is playing. You touching something you should not be touching, and then you did not wash your hands, or you just, you know, poke your nose or did anything that
Mm-hmm.
you're not supposed to be doing. This is enough to get you infected. Is this
Exactly.
going to cause you to have symptoms? No. Now, in the Black African community, when you already have underlying conditions, like we mentioned, obesity, diabetes, hypertension. Because when we say obesity, obesity itself is, you see it on the standpoint of you're overweight, you're obese, but you have to see that this factor is a risk factor for hypertension and diabetes and other complications such as heart disease and kidney failure. So
Mm-hmm.
that's the way it is. So therefore, you cannot exclude obesity on that conversation
Right.
when this is a
Absolutely.
predisposing factor for these. And once you have these and you're not treated because you don't have access to health care or you don't
Right.
have health insurance, you are more likely to take care of your diabetes and your hypertension. Now you're gonna have heart disease
Mm-hmm.
and kidney disease. That is more likely gonna be taken charge by any program that you have in the community.
Mm-hmm.
But you don't have all the counseling that comes with it. Even mental health is an issue. A lot of people are in the streets, you know.
Right.
And let's say that you don't have let's talk about that. For example, just the rave about the Hispanic community. You
Mm-hmm.
see them every single day standing at the Home Depot and everything. That's what they do for a living. They don't have a paycheck coming every single month. They gotta go out there and hustle. It's the same thing for some of the people in the black community. If you don't go hustle out there, you don't have money to bring in your neighborhood. I mean,
Right.
in your house, in your
So you
household.
have to be out there.
You have to be out there.
Mm-hmm.
So when
Mm-hmm.
you ask this person to do social distancing, yes, they may respect that, but not every job that you're doing can have social distancing involved in it.
Right.
You
Allows
know,
you to have social distancing.
especially when we're picking stuff in the streets, we're delivering with it. So there's a lot of things. I've never seen a delivery man standing 6 feet away to deliver something.
Right.
You gotta get close to the person.
Right.
Sometimes they have to sign,
Sign for packages,
the
things like
receipt
that.
and everything. So therefore, these people are
Yeah.
more likely to be exposed.
Right.
And
Like.
adding the underlying condition now,
Mm-hmm.
it's really the underlying condition are impacting the outcome. That doesn't mean every black person that is infected with COVID end up in the hospital is going to die.
Right.
But the more complication that you have related to chronic disease, the more
Yeah.
likely.
You
And I
will.
want people to
Mm-hmm.
know something. The longer you stay on the vent, the worse your prognostic is.
Yeah.
Okay?
Right. Right.
Because
Absolutely.
remember, all of that pressure that goes in your lung also is doing damage to your lung tissue.
Right.
Okay? You would
Mm-hmm.
ideally you don't want to keep someone on a vent too long
Too
because
long.
you know
Exactly.
it's also causing some damage, long-term damage to your lung tissues. So therefore, the longer you stay on the vent, the worse your prognostic is gonna be.
Right. Right.
And if you can be in the hospital when they have it, that's
Mm-hmm.
another factor because you may
Mm-hmm.
go in a hospital and wherever you are, because it's the community, it's the health disparities. We don't have the same structures that you may have on Fifth Avenue. Okay,
Mm-hmm. Mm-hmm.
so
Mm-hmm.
therefore, in those communities, those hospitals are not even equipped to address those type of, I mean, that type of surge,
Right.
and you may end up dying not for lack of care, but we don't have any ventilators available for everybody coming, so we have
Right.
to
That's
manage you
true
in
too.
certain way, and then that's it.
Right.
It's
I know St. Barnabas in the Bronx has a high percentage of people with COVID virus because the Bronx, which has the highest rate of asthma in the country, um is, there's a lot of people getting infected with COVID virus. Actually, the Hispanic community in New York City counts for about 34% of the COVID fatalities actually. Um, yeah, yeah, 34% of the deaths are from, the in the Hispanic community. So this is definitely a minority. There's definitely disparities in minorities overall. When we were talking about essential workers, and a lot of these are blue collar workers who have to go to work, like the MTA, the bus drivers, the trains, like 55 as of Friday, 55 MTA workers died, from
COVID
the
related
COVID.
complications.
Yeah, COVID related. So a lot of them are going out on leave. A lot of them are quarantining themselves. So it's a big mess, honestly. Um, Another police officer died like last week when I spoke about it. There was a police officer that died. He had diabetes and asthma, and then there was recently another death. So these people that have to be in front of people, that's their job because they can't work from home. Like you can work from home, I can work from home a lot of times, so we have that privilege of doing that, and thank God. But then there are people out there that have to be in people's faces. Like there's no other way. They can't work from home and drive the train, they can't work from home and drive the bus, they can't give you your packages and things like that. So one of my recommendations for people that do have to be out there is like, because some of these masks are not that effective. So I would double up on, honestly, some of these masks. Because, I got a N95, which works, but some of these surgical masks are not that great. So I would really actually double up on those surgical masks and put two, just to really protect your nose and your mouth from getting any droplets. And then also make sure it's sealed, over here, because I see people with the over here is open, and then stuff can get in here. You got to pinch the nose part too, with these masks, because you have to make sure nothing can get in and it's kind of sealed. So you have to do that as much as possible, you know.
But but that's actually what they trying to prone. And then let's say like family wise, yes, you practice the social distancing. Me personally, every time I go to the grocery store, it's like I'm like on watch mode, and I don't even know what I'm watching, what I'm looking for, because everybody looks healthy to me.
Right,
It's not
right.
I've never gone to the no grocery stores and saw someone coughing, sneezing. Everybody looks healthy, and everybody's been inside for so long that when they finally see people, they want to chit chat, they want to talk.
Yeah,
And although some supermarkets may have implemented some, put some scotch tape on the floor just to, give you allow you to
make
have a
sure
certain
there's social
distance.
distancing.
But here here and there, if you go to another place and it's, for example, in a black community, you don't even
Hmm.
see that. It's like there's a general responsibility that
Right,
must be done. It's like, why is it so common that they are taking those measures, making people go in line so we don't kind of, cross each other's path in the same in two different directions. Everybody's
right.
going to the same direction to the supermarket, make it like a straight path for everybody so you can protect this. But these are minimum things that you can do. It makes
Hmm.
no sense to me that I'm looking at some grocery stores, supermarkets in the, you know, black African communities. There's a total disregard about those measures. You
Oh,
know,
okay. So
you know,
you haven't seen lines in African American, mostly African American Hispanic communities. You haven't seen lines.
you look at some videos, they're crowded. People posting videos when they go shopping
Oh,
and say people are disregarding those things. You
right.
know,
Mm.
and one thing people have also is we have in the culture of always being in denial. We do
Right,
that all the time.
right.
It's like they tell you that to wear your seatbelt and you think it's not cool to wear your seatbelt and you're still driving your car with no seatbelt.
True,
And
true.
once you get in a car accident, now it becomes a factor, of poor prognostic, because it's different if I get hit when I have my seatbelt and you don't have your seatbelt. So
Hmm.
these are different things that we have to start respecting. There are science behind everything. It doesn't have to make sense.
Right.
It doesn't
Right.
have to make sense. The numbers don't lie.
Mm.
And that's the culture people needs to have. I don't owe you some explanations about everything. You know,
Yeah. True.
wait. If it's proven people doing this, it's effective, do it. You don't need to
Right.
question because
Yeah.
it's the whole culture of I don't care about it. We are disregarding. We're still saying in the corner five, six, seven people there. And then guess
Mm.
what? You may be healthy with the disease you contracting it, but everybody got an elderly in the house. Everybody got a mom or dad
True.
that is over 60, over 55. And then some people are getting sick and even ending in a hospital younger at age like 37,
Yeah. Yeah.
because
On a
those
vent.
those factors that
Mm.
we are talking about, they may not be as prevalent in the other communities,
Right.
white communities, but
Yeah.
minorities that don't have access to preventive care. And
Right.
that's the whole thing. It's screening and preventive. We don't have
Yeah.
no screening and no preventive care. And if it comes, it's scattered in the community. And let's talk about community, what we call war zone. Okay,
Yeah.
war zone. So where you gonna go put and implement a preventive program over there? So these people are live to themselves until they get sick and end up in the ER, and
Mm-hmm.
ER that are disturbing this community. They already have a surge of other stuff. They have less equipment. Most people don't want to go work in an area like that. So it's a whole different.
That's
I mean,
true.
a lot of things coming into
Yeah.
place that
Right.
down the line you represent like 13.2% of the population, but
Right.
you accounting for more death rates from
Right.
something that they've been talking about it. This has been the subject, and I even blame like black African Americans who are in like wealthy, that has a celebrity status and everything.
Mm.
Lately, you've been seeing that there's a movement that everybody is going toward, leaning toward a healthy program, a health weight program. Everybody want to
Okay.
lose weight. They have those data. These are the data that they have telling them, you know what, if you don't change your ways, you're gonna end up this way. Once you have this, you are more likely to die from it. I don't care if
Right.
you have money or not.
Right.
Right now, if you don't take care of yourself and you don't have a steady weight, because
Mm-hmm.
there's being overweight and being obese.
Yeah.
Okay,
There's a
and people don't
difference.
get, you may be overweight, you're still predisposed, but you're still borderline. But once you are obese and now you getting diagnosed, or you're saying you're pre-diabetic, or you have hypertension, you have hyperlipidemia, you should stop. This should be a wake-up call, because the next step now is to have heart disease, is to have
Right.
kidney failure, you know. And if you
So
add all of the other stuff like
yeah.
drugs, alcohol, which sometimes we are in denial, like it's something that doesn't exist in the community.
Right. And
And
I wanted to talk about that because a lot of people in our community there's a lot of conspiracy theories. You know what I'm saying? Like this, corona's fake. I hear people in the hood just they all smoking weed and they passing it to each other like corona doesn't exist. So there's a lot of conspiracy theories. Like I get some of them, like, oh, they want to take away cash, so they brought this virus and the virus is not real. Like things like that. um and I can understand African Americans and the doubt that we have sometimes because the government has done things to violate us, like the Tuskegee experiment, where they gave African Americans syphilis for years. So they kept injecting them with syphilis just to see what happens. And they were telling them that they were giving them something good. So there's a history behind there that allows people to not want to pay attention or not trust the government. But people are dying, so this is obviously real. You know what I'm saying? If you think the virus is man made or not, I have my opinions on it. I think it's man made too, but it's here. You know what I'm saying? So people can't just, pretend it's not, or trust the conspiracy theories. You gotta, and also people gotta think about where these conspiracy theories are coming from. They found that a lot of stuff that are messages that's coming in our Facebook and stuff like that are coming from Russia, just to influence the African American community, and you're thinking, oh, this is good stuff, this is conspiracy stuff, I need to hear it, but it's to make you sway away from what you need to do. So
Yes, I agree.
obviously coronavirus is here. 70% of Louisiana, that's the people that's dying, is African American. 34% of people that's dying in New York City are Hispanic. Okay, so it's here. So we need to not. I don't. Whatever your conspiracy theory is, okay, cool. All right, go run with it. But the thing is, it's still here. So we
And
need
and
to.
and, and that's the
Mm-hmm.
point that I was making is people here they want an explanation. It's like it's and I mean it's sad, but at the same it's just and at the same time is people get this right here is an opportunity to educate yourself.
Right.
Okay, but people, and Charlemagne the God likes to say that, and I understand it when I mean it took me a while to understand when he used to say that nobody cares about the truth when the lie is more entertaining. You know,
True.
people tend to gravitate
True.
around information that are like worthless, you
Right.
know, and they can give their own interpretation, and then it makes them feel, a little bit of way of, I mean, as like, give them a sense of, oh, I understand. If I can understand that, that means that I'm not that bad, you know.
Right.
I can have a conversation with people. You did this experience several times. You've seen it several times. You say something to one person ear, and you tell them to pass that message. By the time that message gets to the end of the line, it's a total different message because everybody hear the same thing, but we don't grasp it the same way.
Right.
That's why some people may need counseling, some people may need schooling sessions for some stuff
Mm-hmm. Mm-hmm.
because the interpretation you're gonna give to it is different. And now we think to hear what makes it feel like superheroes. Oh, there was that guy from China, that African American, and the Chinese government says the reason why he did not die, it's because of his, genetic constitution.
His
Because he
color,
didn't want he
his
didn't he didn't
melanin.
want he didn't want to say because he's black, he
Uh-huh.
just said that because of his genes and everything. And
Uh-huh.
everybody took that information like it was, you know, a life-saving information. Oh, so if we are black, we are less likely to die from this disease. But nobody told you this guy that was infected, that he was diabetic, he was hypertensive, he was overweight. No, none of those factors were there. So that was actually a healthy young man that contracted the disease, and that bounced back from it, like most people in America that called their doctors, tested positive for COVID, had mild symptoms, and recovered
Right.
from it.
Right.
Okay, because
And
that was an early
mhm.
stage of the disease. They don't know what was going on until they found out that some people will have no symptoms at all. I heard someone said yesterday, he's a director of CDC. I I was surprised when he said like 98% of the people who are infected won't have any symptoms.
He said 98.
Yeah, 98%.
Mm-hmm.
So that's
Mm-hmm.
concerning. So
Mm-hmm.
that means there's a huge percentage of people that's gonna
Right.
go out there, that's
Yeah.
gonna get infected, that's
Right.
gonna get another person infected until that infection gets to someone that is vulnerable. But in our community, how many people around you, like mom, aunties, uncles, that are overweight or obese? And that's the danger. And we are
Yeah.
not practicing that social distancing, and we're not protecting them. Because I'm not saying it's a selfishness, because like I said, people have to go out. But if you get the right information, and at least you can identify people who are at risk in your community, you know, I don't care if you're out there going out there every single day, but you have a grandmother that is in the house. You should know that you should avoid limiting
Absolutely.
contact. Stop touching stuff that she's touching in the house, because now they're asking people when you go do your groceries, since the virus can stay on the package
Right.
for 3 hours and the plastic bag for 9 hours, that
Yeah.
you should wipe all of that stuff. How many of you guys been doing this since January that this disease been
Right.
around?
Right.
So
Yeah.
if grocery stores I mean, if my mistake was the grocery stores, I probably contracted it already,
Right.
you know,
Yeah.
because
Like it's so
because it took me a while
contagious.
to even realize that, oh, I should be doing this because people actually go to the grocery stores touching a lot of stuff.
Right.
You know, it's like, oh, one pack of macaroni and they put it back, you take a second one. I'm like, what information are you looking in this freaking it's the same thing. What exactly are you looking for? It's like
Right.
reading the, the label and everything, and they're touching six of them until they can finally pick one. Banana,
Exactly.
plantains, people are touching, oh, I don't like this one. I'm looking
Exactly.
around.
I was thinking about that the other day because I bought some grapes, and I'm like, how many people touch this package of grapes? And that's one thing everyone has to do when you buy fruit and stuff. Don't just use water. Put some soap in there and wash it. Because this virus is very infectious. It stays on surfaces. It even stays studies show that it stays if in the refrigerator. If it's in the refrigerator, it can survive for 28 days. So for a whole month, you can have the coronavirus in your refrigerator. So it's important to like clean things off. But honestly, don't touch your face. That's what I'm realizing. That's the best way, because you could wash your hands and then you just touch something on the counter and then you know what I'm saying. So just the main thing, because it can't. Corona's not going through your skin. Okay, so don't touch your face. Don't touch your mouth, your nose at this point. And if you need to blow your nose or touch your mouth or something or your eyes or whatever, wash your hands right away and then do it. Wash your
Yeah,
hands, then blow your nose.
and I even told people is, for example, if you go to the grocery store and you buy stuff, I mean, it's just a simple advice. It may not have no scientific meaning, but
Right.
if they tell you that, for example, the virus can survive up to 3 hours or 9 hours on this, if you go to
Mm-hmm.
the grocery stores, like you buy fruits and everything, so expect to eat it the next day. So
Uh-huh.
there's a cycle of 24 hours now. Whatever you bought today, you're not gonna touch it, because I'm not expecting any elderly, for example, that went to the grocery store that's gonna stand up for hours cleaning all that stuff. But
Right.
if it's not something you're gonna use immediately, put it somewhere, give it a spin of, 24 hours. So
Right.
now you know that, okay, these are stuff that I bought yesterday, but it's
It should be
confirmed that
okay.
24 hours after it should be okay. Because you
Unless
gotta,
it's in
I
the
mean,
freeze,
develop your,
unless it's in the refrigerator, then that's a more of a
yes,
problem.
but
Because
most
it,
likely food that are gonna go in the I mean, refrigerators are most likely things that are packed. So you can actually put Clorox wipes and then
yeah,
go, right. But now, let's be realistic. Where can you find Clorox wipes?
that's what I'm
Okay,
saying.
so
You
I'm
got
using alternatives, things that I'm buying on the internet. You don't even know if these things are coronavirus approved. So
hmm
therefore, you are in a situation is that the best way to protect yourself, like you said, is just wash your hands. Wash your hands every time you're gonna put it in your mouth, because
yeah,
you know we you are running out of options. But
right,
at the same time, the main route of and we said it, your biggest enemy are those,
yeah,
you know, your hands. Wash them. It doesn't count. You know, I mean, I even think that I have compulsive disorders. Is like if I touch a place that I don't feel that was clean in the house, I'm like, oh shit, let me just go wash my hands.
right.
And then 5 minutes you have, you're gonna go eat. You go wash your hands.
Again,
It's
constantly,
not gonna stay with you for the rest of your life. But
right.
let's be realistic as well. Those underlying factors that are relating to your behavior, I
Yep,
mean, the way you're eating, the way your lifestyle, these are things you can change down the line. You know,
absolutely,
you can control your diabetes. I think now, if you're sick, the government has a responsibility now, to have some type of health plan that would allow these people not to just take medication. And that's the culture we have here is we want to give people medication for the same thing that we could correct by allowing them the opportunity of having a healthy lifestyle. But for
amen.
example,
Mm-hmm.
in Europe, we don't have that rate of obesity in Europe. You don't have all these people with diabetes or hypertension, but they
Right.
have their own demons. 15 years old is smoking like a dragon. So
Yeah,
now, if talking
true.
about like if you're 30 something years, you already have COPD or all the chronic
Right, because they
disease
smoke a
related to
lot.
cigarettes. So this could be a factor why people are dying. So what you think they're gonna do? They're gonna study this. They're gonna say, you know what? The reason why we had all those fatalities is because we've been closing our eyes with the issue on cigarettes now. We got to
Hmm.
go harder, on these things. We got to provide more alternatives for these
Right.
people to quit cigarettes
Right.
so they can prevent this from
Let me shout out Italian Girl 363. Thank you for wishing us a happy Easter. Thank you.
uh,
Go ahead.
and that's also my coworker. That's my coworker.
Oh,
So
okay,
hey,
okay. That's what's up.
hey
That's what's up.
Christine, how you doing? So yes, we have to address these, but we cannot. This is the first time you have a disease that is affecting most people, and it's the same for every country. It's poor people, people that have like access to care, and
Right.
people with those underlying conditions. But we
Mm-hmm.
don't have the same factors everywhere. So we got to be able to at least say, you know what, this was the underlying determinant of health in the Black African community. If obesity is the basis of all of those chronic disease that led them to not being able to
Right.
respond to this disease, something must be done.
Mm-hmm.
Because why are you saying those athletes, those big celebrities,
Mm-hmm.
engaging in a healthy lifestyle? They don't want to look good on for their picture on Instagram. That's not the goal of those programs.
Right.
It's to give you more chances of having, I mean, more chances of
Mm-hmm.
not developing those chronic disease that are linked to these things. I don't
Right.
think people actually understand that. If you
Mm-hmm.
are obese for years and you continue having I mean, a sedentary lifestyle,
Right.
you're not
So
exercising a lot,
right.
I guarantee you're gonna end up with hypertension or
Yeah.
diabetes.
Right.
There's no way around it.
Right.
Amen.
There's
And
no,
the
I agree. There's no way around it. Your nutrition and getting exercise in, that keeps your body at peak condition, and it prevents a lot of these underlying diseases. So we can't say that, okay, I'm just going to eat whatever I want. I'm young, stuff, because what builds up in your body in by your time you're 30, 40, and then they say, okay, you're diabetic. You have to watch. We have to watch what we eat. We have to eat more fruits and vegetables. We can't eat all these. And that's another thing in these communities. There's a lot of food that has a lot of preservatives. That's cheap, but they have no nutritional value. So that's another thing that's affecting the community as well.
yes, and
So.
then it's cultural as well. You gotta
Mhm.
understand that we always, worship soul food. We always talk about these things, and then it it keeps adding up. It makes no sense for me. Like sometimes is you look at a whole family, and you see the whole family is from overweight or obese to morbidly
Right.
obese. So it tells you culturally something is wrong in this community. But at
Mhm.
the same time, there are different communities in this country. You have the Indians, you have the Chinese. They're not rich. A lot of them are poor. They
True.
came poor from
They're
other
immigrants
countries,
too.
and they're immigrants, and they still poor in United States, but they still able to survive because this is a country of opportunities.
Right.
Are they obese? You know,
Mhm. Right.
how do they manage to still have a steady weight? Or it's because probably culturally speaking, they don't eat all of that stuff that other peoples are eating that causing you to. That's why the shift has to be done. It's the portion. Nobody tells you you have to stop eating some stuff, but the portion is too big, and this is what's causing that excess calorie
Right.
that you're not gonna even burn because you're actually inactive. And if you're not working, you spend your whole day, you know, watching TV or, inactive.
Mhm.
Let's say that's just a way of picturing it. You know,
Right.
it's not helping you. You still have the culture, but you say I would like to go run in the park. The neighborhood is not safe. So it's not
That's
it's
true.
not it's it's not it's not in
That's true.
just we have to change it. there
Right.
must be also the commitment of the government to say, there's a
Absolutely.
situation going on over there that is
Absolutely.
making people not only not able to have access to what's, because even you can tell that eating healthy is not cheap.
It's not.
What eating healthy costs you a lot of money. Just a protein program, just a weight loss program could be 150 a month. Not
Right.
everybody can afford to pay that, and you feel me?
Right.
And then when you add the gym subscription and everything, if that's what you want, it becomes it's not even, it becomes like a lifestyle, and
Yeah.
people think that, oh, this guy, he's a gym addict, he's this is it, because that's the only alternative, and it shouldn't be
Right.
like that. They don't do that in Europe. Portions are controlled. People don't have access to all of those fatty food,
Uh-huh.
and then they stress on restaurants to have healthy choices.
Right.
Have healthy choices at I mean, a low
I
price.
mean, we have done that a little bit because I remember because especially McDonald's used to do the supersize, for extra 50 cents or whatever you supersize. So that was cut out in America, thank God, because that was making people big, extremely big. But I don't want to give people excuses. Vegetables are extremely cheap. Fruits are cheap as well. You could buy like 8 bananas for $2. You know what I'm saying? So I don't want to give people excuses like, oh, we can't eat right because everything is so expensive. Yeah, I mean Whole Foods is expensive. I don't go to Whole Foods. I go to Trader Joe's. Shout out to Trader Joe's. But I go to Trader Joe's and like there's things that you can do to remain healthy. Stay away from packaged foods. Like you have to really look at the ingredients in foods. There's certain things that are carcinogenic that they still put in food today. And whenever you see it, I forgot the name, cargin. It started with a C, cargin something. You gotta those things you have to take look at and take care. People gotta love themselves and realize that nutrition is loving yourself. Exercise is loving yourself. Okay, but yeah, that's pretty much what it is. Like I really, I really think people should just not touch their face unless they just clean their hands. I think that's the best solution, honestly, is don't touch your face unless you just wash your hands. And when you come home from outside, wash your face because those droplets and people talking, they probably landed on your face. You know what I'm saying? So I think that's
But
the best thing to do right now.
but even here is, when you think about it, also it's people that have probably access to clean water, because when you're talking about some neighborhood, Black African American neighborhoods, people don't
We
have no
might get
running.
we might get cut off in an hour. I think the Instagram live cut you off in an hour.
Okay, because you don't have no running water. Some people, they just shut down their water because they don't have any jobs and everything. So it's a lot of different things that I feel that, I mean, as a community we could do better, but the government failed also to provide those minimum, because it makes no sense that someone that just lost their job uh live paycheck to paycheck, and then now you have to cut their water, and now you're asking them, hey, you have to wash your hands every
Right. The
20 seconds
government
and everything.
has more of a responsibility to
You know,
help us.
so therefore the situation in there, but it's also an overwhelmed situation. Is someone has to advocate about these things and say, hey, this makes no sense for this community.